Hello, I'm Dr. Dory McCubry, and I'm so excited to have so many of you here for today's presentation of A Taste of EDIT, Eating Disorder Intuitive Therapy. And just a reminder again that you can get your presentation handout on the editcertified.com website. That's editcertified.com/webinar. And you can download the presentation handout and follow along and take a few notes. I'd like to begin with a few learning objectives for the presentation. At the conclusion, you will be able to list the 5 principles of eating disorder intuitive therapy, EDIT, and also discuss their evidence-based foundations. In addition, you will be able to share the descriptions of 5 key EDIT worksheets that are most commonly used to guide clients in freedom from eating disorders. And then finally, if you're interested in becoming EDIT certified, so there are certifications that are available in this method of eating disorder intuitive therapy. So you'll be able to discuss the benefits of being an EDIT certified treatment clinician, recovery coach, or peer mentor. So a little bit about the history of EDIT. So I want to emphasize for you that EDIT has been used in clinical settings for more than 25 years. So this began after my own journey of recovery, and then I founded my own practice, Positive Pathways, in Northeast Ohio. And at first, this was called the McCubry Method by one of my mentors. She recognized that I had something unique. I had a very specialized approach to eating disorder recovery. And being very passionate about getting my message out, my first book came out in 1998. And then I relocated to the Denver, Colorado area, where I love living and being. And then my second book was published in 2003. And shortly after that is when I started being approached by wellness professionals asking to be trained in my method. And I was like, wow, I guess I, can develop some training materials to help people learn this. And I also started supervising and training counselor interns and mental health clinicians and other types of professionals. So shortly after that, I renamed my method Eating Disorder Intuitive Therapy, or EDIT, because, we have to have acronyms, right? Like cognitive behavioral therapy is CBT, which you're going to learn is one of the evidence-based practices that is woven throughout EDIT. And so in addition to renaming the method, that's when I developed clinical tools and the training programs so that people could earn a certification in this method. And as of 2021, there are hundreds of EDIT certified professionals located worldwide. So let's take a look at how we could define what is EDIT. So one way is it's feeding the eating disorder mind through thought, its. So this is, again, where you're going to see some CBT incorporated. So we're looking at those thoughts that I call that eating disorder mind, or ed. And then we're looking at a different way of thinking. And it goes a little bit beyond just the reframing through CBT, cognitive behavioral therapy, because we're really looking at intuitive messaging. So a way of not just thinking differently, but really feeling differently from within. So the eating disorder client might say something like, ugh, I look so fat, I've got to lose weight. If I could just do that, I wouldn't have an eating disorder. My life would be all better. Kind of some magical thinking there. And then the intuitive therapist, and this is what people who become EDIT certified learn how to do and be. So the intuitive therapist is modeling this voice of intuition until the client can hear it within themselves. And they might say something like, love yourself. Right now, today, let's explore how to do that no matter what you weigh. From this loving perspective, let's notice how your entire life can improve. So at first, clients can really struggle, is they only hear, most of the time, they only hear the voice of their eating disorder. And, the blue text bubbles illustrate other things that voice of Ed says. So, maybe it's I can't cope, like I'm having a really rough day. I just can't deal with this. I just can't wait until, maybe I can go running for 10 miles and, maybe I can get home and binge eat or purge. And so these are what we might call maladaptive ways of coping, but it's the only thing the client knows. So through the other EDIT principles, like be true to yourself, express yourself, give to yourself, you're going to learn more about these as I go along. But this is what we're teaching the clients so that they can replace that eating disorder mind and those behaviors with healthy ways of coping and living. So another way to define and explore EDIT is that it's a release of what I call a false self. So this is where the person in general is looking outside themselves for who they should be, how they should look, how they should behave. So it's very outer directed people pleasing. And the false self tends to be very critical and critical about everything. So it's just never good enough. But there's often this focus on the body and controlling eating and using that as a way to, hopefully be good enough for this outside world. And then through the practice of the 5 principles, then the shift happens from ed to it, false self to true self. And clients learn, they have these outcomes of self-compassion. They develop this overall sense of intuitive wisdom and guidance about their eating. They've learned those healthy ways of coping and self-care practices that become their way of living. EDIT can also be defined as a comprehensive, holistic, integrative eating disorder treatment. So it is rooted in evidence-based practice from cognitive behavioral therapy, which is considered the gold standard for eating disorder treatment. And again, as I've mentioned, CBT and techniques from CBT and practices that are evidence-based are woven throughout this EDIT methodology. DBT, or dialectical behavior therapy, is another type of treatment that is evidence-based for other types of issues like personality disorders. That's how it originated. And there's research going on so that eventually we're hoping, I certainly see the effects that are positive with DBT, so that DBT becomes an evidence-based practice for eating disorder treatment. Similarly with acceptance and commitment therapy. So these are newer therapies currently being researched, and I've woven these into the EDIT methodology as well, again, because they show such promise and, again, beneficial outcomes for eating disorder treatment. And the EDIT method also has roots in transpersonal psychology, or spiritual counseling, it's sometimes referred to as well. And this is where the intuitive aspects come from. I also draw from intuitive eating, other kinds of practices. And what you'll see is that this is, again, a comprehensive treatment approach that addresses all of the essential areas of eating disorder recovery. So instead of just needing maybe something to deal with a client's body image, and you're looking for some tools or techniques over there, and then you realize that you need some specific coping skills for eating disorder recovery, and you're looking again in another place over there, and then you need something for relapse prevention, and so you're trying to piece things together. Well, the EDIT method includes all of these essential areas of treatment in one place.